Today we're going to be going over the application of topical ointments that can help with increasing blood flow to an area that's not getting the greatest blood flow. So what I want to show you is the list of equipment that you're going to need. It's very simple. We have a Q-tip, tongue blade, a product called DMSO, which our office will provide you a link to be able to obtain that online. We want at least a 70% pure DMSO or higher. Also NitroBid, which is something that our office will also give you a prescription for. You can use a silicone border dressing or a transparent quote unquote tegaderm dressing. Definitely need gloves in order to keep this NitroBid off of the hands of the person who's assisting, and then of course your patient. Occasionally when procedures are done, we will violate the blood supply to the skin or to an area that needs help with being able to get more blood into that region. That's what's called ischemia. Conversely, there can be something called venous congestion, which means that the highway for the blood that's returning back to the heart is backed up, and that area is now becoming dark and purple because that blood cannot return back towards where it came from. In that instance, in either instance, we need to increase the diameter of the blood vessels that are leading into that area and out of that area. So what these products do is they actually cause vasodilation. And vasodilation is when we have a blood vessel that looks like this, but we want to make it look like this. So we're trying to get that tube to open up. What that will do is it will help with being able to get some of the free radicals out of the area that are causing damage to the skin. And that's also where DMSO can be very, very helpful. This product has the ability of being able to assist with the delivery of topical ointments deeper into the skin tissues, whereas NitroBid has the ability to be able to vasodilate. So in combination, these two drugs can be very, very helpful with being able to rejuvenate certain portions of deoxygenated skin. So how do we prepare? We prepare by taking a look at our wound, washing it with warm soapy water. Then what I'm gonna do is I'm gonna cleanse my hands with a hand sanitizer. And as I mentioned before, we definitively wanna use gloves. One of the side effects of NitroBid is that it can cause headaches simply because it is a vasodilator. It can mildly drop your blood pressure. And with that drop in blood pressure, we subsequently can develop some degree of headaches from that application. And it means one of two things if we wanna be able to try and reduce the number of headaches. Number one, we can reduce the amount of NitroBid being used, or two, we can reduce the frequency of the application of the NitroBid. So now I have my gloves on, I'm ready to get the topical ointment ready. So what I'll do is I will recommend that patients have a separate jar that they can take approximately 3 to 4 tablespoons of the DMSO cream and apply that directly into a small jar that can be capped. After that's been applied, what we want to do is we want to take about 1 gram of NitroBid and mix that into our DMSO cream. And I want to show you what 1 gram looks like. So this 1 gram, you can see by comparison, if you're looking at a Q-tip, it's slightly more than about 2 to 3 Q-tips worth of NitroBid. Now what I'm going to do is I'm going to take this and I'm gonna mix it in with the DMSO cream, making sure that it's evenly distributed throughout. And now that we have it folded in, our topical ointment is ready to go. As we mentioned before, we prepared the wound by washing it with some warm soapy water, then patting it dry. So the surface is now ready to receive that topical ointment. I'm just gonna apply just a thin layer, almost like I'm frosting a cake. Or maybe more like cinnamon rolls. So you can see that there's a light frosting over top of this region, and I actually want to get it outside of that area as well because we want to increase the perfusion from all of the healthy blood vessels outside of that zone of injury. After we've done that, it's important to lock the medication in with some type of topical dressing that will prevent it from being absorbed by clothes or other dressings or bedding at night, whatever it may be. One of the easiest things to do is to take one of these transparent dressings and apply that directly over top of that ointment in order to lock it in place. Now you can see you have to have a nice border around the edge in order to prevent this medication from getting outside of this dressing. Alternatively, you can use one of these silicone border dressings that's very easy on the skin. It's much easier to take on and off, but it is a thicker, bulkier dressing. Now this we leave in place for approximately 6 to 8 hours at a time. And then when we remove it, peel up one of the edges. Use a dry gauze or, again, a warm, soapy washcloth to be able to wipe off that residual medication that was previously applied, and then we do it all over again. Oftentimes, when we're trying to increase perfusion, we'll do a couple different things. We may ask that you take an 81 milligram aspirin, and what that does is that makes the platelets and the red blood cells very slippery so that they can go through really tiny blood vessels without getting clotted or clogged, and that can be very beneficial to increasing perfusion into that region. Some other things we might do are some blood thinning medications that might help with being able to get more blood flow into that region. Some degree of hyperbaric therapy may even be of benefit, and that's something that we'll discuss with you at the time in order to determine whether or not you're a great candidate for that. Now this process may take 3 to 5 days. Sometimes, in some rare instances, we may do it beyond a week. And all this is doing is trying to increase blood flow to an area that may be of concern. We don't always know whether or not it's a perfusion issue. Sometimes it looks like a really bad bruise, and maybe it is just bruising that'll resolve and be self-limiting once we give it some time. General rule of thumb, we're always going to over-treat areas that we're concerned about rather than under-treat. A very important point to note is that sometimes patients will get headaches and some dizziness and lightheadedness when they're using NitroBid. And that's simply because the product is a vasodilator, and with that, it will diminish your systolic blood pressure and can sometimes make you a little bit woozy or a little bit drowsy. If you're having frequent headaches, if you're having low blood pressures that are going significantly below 100, maybe into low 90s, we would ask that you decrease either the frequency of the application of the NitroBid or you decrease the amount of NitroBid being used with each session. These are the things that we're gonna do to be able to maximize your healing and be able to ensure that you have an excellent outcome regardless of the procedure.